Hi, my name is Tania Johnson. I'm a registered psychologist and one of the founders of the Institute of Child Psychology. We recently posted a post on our Facebook page to do with ADHD, and it was met with many emotional responses. Remarkably, even though ADHD is one of our most commonly diagnosed issues in childhood, it still has so much controversy around it in a number of different areas. One of those areas being, is it overdiagnosed, underdiagnosed, or misdiagnosed? It doesn't really matter which perspective you take, you can find research for each one of those perspectives. As a clinician, I'm more interested in saying, what do our children really need right now? And regardless of whether it's underdiagnosed, overdiagnosed, or misdiagnosed, what's happening to even make this a question? And so we sit down and we go, okay, so what are some of the factors that might be overlapping that could be creating some of this confusion? So let's look at some of the psychological issues that sometimes look like ADHD and then are diagnosed as ADHD when in fact it's something else entirely. So let's look, for example, at depression. Depression often looks like our ADHD, predominantly inattentive type. Think about when you are feeling sad, and for those children who are depressed daily on an ongoing basis, how hard it is to participate, to pay attention, to follow through, to remember where all of your things are. Looks very similar to ADHD, predominantly inattentive type. For our children who are anxious, think about yourself when you're worried. So when we're anxious, we either go into fight, flight, freeze, or collapse. Think about each one of those and how closely that mimics ADHD, ADHD predominantly hyperactive type. So difficulty sitting still, paying attention, we interrupt, we are constantly acting as if we're run by a motor. We are short-tempered, or we have a short fuse, all of those things that we feel when we're worried ourselves. So is it depression? Is it anxiety? Is it trauma? We have a wonderful paper that we can give to those who inquire. We have a wonderful paper at the Institute which shows how many of the trauma symptoms overlap with the ADHD symptoms. Again, the inability to focus, to pay attention, to follow through, to regulate some of those emotional states. Maturity is another one. One particular research study found that children who are born after the kindergarten cutoff date are 25% less likely than children born before the kindergarten cutoff date to be diagnosed with ADHD. Again, many of these are normal childhood behaviors that sometimes we're not understanding correctly. Sometimes it can be cultural too. So we'll see children who will come to a new country which doesn't have the same way of interacting with adults in the way that they're used to. So for example, children who are from a storytelling culture. So as a clinician, I'm always interested when a child comes into my office. Is this actually anxiety? Is it depression? Is it trauma? Is it ongoing stresses? Is it grief? Grief can look like inattention to. Is this maturity? Is this a cultural factor that I'm looking at? These are always questions that I'm asking myself, and always questions that the clinician you're working with, that you want them to ask too. We don't simply want to go into an office, have checklists that are sent home. We really want our professionals to be thinking very, very clearly through what's happening for our child. Before I diagnose, and this is true for any mental health struggle or any difference in seeing the world, I also always want my children to go to the doctor. So I want them to be tested for hearing. When we can't hear properly, again, it's hard to pay attention. It's hard to focus, to follow through on instructions. So is this a hearing issue? Is it a vision issue? If I have problems seeing the whiteboard, I'm probably not going to stay focused for very long. Is this a blood sugar level? We know that when children's sugars dip, we often see some behavioral issues, again, which can be mistaken for something like ADHD. Is this a sleep issue? We know what it's like when we're tired. Again, many of those similar symptoms of ADHD pop up. So really, I want them to go into their doctor for full checkup, then I want them to sit with me and I want to be able to go through all of those other things that could look like ADHD and say to myself, Tania, is this anxiety? Does this child fit the criteria for anxiety or not? Should you be considering depression? Should you be considering grief? Should you be considering trauma? Should you be considering other developmental issues? I want to know that I've looked at all of those issues as well. And then in a perfect world, I also want to have spoken to as many family members as possible so I can get a full idea of this child. I don't want a checklist to go home just to the teacher of whose grade the child is in that year. I also wanted to go to the teacher the year before so that I have a comparison to make. Is this an environmental issue? Is it a relationship issue with the teacher? Or is this a stable characteristic that we're seeing? In my own clinical practice, if I question, is this anxiety, I always treat the anxiety first. And then if I'm still seeing those symptoms come up, then I say to mom or dad, let's sit down and look, are we actually looking at an ADHD diagnosis here? So all of the controversy, misdiagnosed, overdiagnosed, underdiagnosed, let's just focus on our children and really, really, really make sure that the professionals we are working with are slowing down, looking at all different angles, and really focusing on the long-term well-being of our children. For those of you that are interested, there's also a wonderful YouTube video as well as a number of articles from the journalist Alan Schwartz that looked into ADHD and the phenomena of more and more children being diagnosed with ADHD. Thank you.